What we really wanted was to have the ability to have paediatric nurses in the emergency department to help with continuity of care. Well, it's wanting to get the experience of the nurses from our ward, because we have 23% of the people that come into emergency department are paediatric. So that is quite a large proportion of the presentations. And often children that come into ED, there are a reasonable percentage that are very, very sick and need to be seen to straight away. But a lot of the things that they come into emergency for, there's a wait because it's a prioritised system. So having a child sitting in an emergency department that's really, really busy is not always ideal. So to have a paediatric nurse that understands the family dynamics and trying to alleviate the anxieties, it's also there to help emergency department. Like, we're an additional set of hands to help with that family, to alleviate issues, to be a resource and to help with continuity of care. It was a long time in its conception. We worked with the staff on the ward, because what we've asked for is that our staff from our ward give up their evening shift to be available to go and work in the emergency department. I think anecdotally from families we're getting lots of positive feedback, like they'll come to the ward and the same nurse that has visited them in the emergency department and met them and started doing the admission is then on the ward and carries on the care and is often back the next morning. And so it's like this, familiarisation and that sort of nice feel to it. We're hoping that with this position that we can actually expedite the things that happen in the emergency department and get them home. So like, it's not necessarily for admission, it can be to make sure that they get the right medication, information, and get them home with the follow-up, because we actually have a paediatric home care program that can go and visit a couple of days after if there's a problem and they're not feeling confident, and otherwise they may have come in as an inpatient because not sure how they cope at home. But if they know that a nurse can come and see them in the home, then they're happy to go home and knowing that they're going to get some people come and see them. Some staff have taken it to it really well, and we'd really like to get this position up and running and actually recruit to it. So having a different person in the role each time makes it hard for the emergency department, because they're not sure, like, different people do different things. So to have a couple of people working in that role would be ideal. Because you're there in their department, like, you need to be one of their team as well. So it's about working with the child and adolescent unit. It's about working with the emergency department. It's about working with the family. So it's quite a complex role in that you've got lots of people's needs that you need to meet. And really, we put this forward to really feel the waters, to see if we could affect a change by having a paediatric focused nurse to start pulling patients into the ward quicker, to get them home quicker, to get our paediatric home care involved, like to increase that. So if we were to show that there was a marked improvement, it's definitely a role that we would like to implement. That's what we're about. We're there to help the families, to help the children, to make it a better journey through the emergency department, because it's a busy place. There's things that you don't really want children to see. So if we can get there, make it a better experience for them, then it's been a success.